So the distinction between inflammatory bowel disease, which includes ulcerative colitis and Crohn's disease and eosinophilic esophagitis, is pretty clear-cut. So inflammatory bowel disease affects the lower part of the gastrointestinal tract, most commonly the colon and sometimes the small intestine. And when it involves the small intestine, it's usually the last portion of the small intestine, whereas eosinophilic esophagitis affects the top part of the GI tract, which is the esophagus. So they are both forms of inflammation of the intestinal tract, but one is affecting predominantly the esophagus, the other one is affecting the lower part of the bowel. The symptoms are very different. For inflammatory bowel disease, patients are having symptoms of diarrhea or abdominal pain or bleeding, weight loss, whereas with eosinophilic esophagitis, the symptoms are trouble swallowing and food impaction, sometimes heartburn or chest pain. That being said, there is a little bit of overlap. Some patients with inflammatory bowel disease, particularly Crohn's disease, can have inflammation that extends up to their stomach and sometimes even esophagus, and that can sometimes be confused with eosinophilic esophagitis. So Crohn's disease of the esophagus can produce symptoms that are similar to eosinophilic esophagitis. It can produce difficulty swallowing or pain with swallowing. It can produce abdominal pain. The distinction is made by looking for effects on the bowel below the esophagus. If there are evidence of inflammation in the intestinal tract or colon, you may be dealing with Crohn's disease and not eosinophilic esophagitis.